Aditi Ahuja, and I worked in a lab at the University of Pennsylvania under the mentorship of Dr. Nicola Mason to study the effects of HER2 expression on osteosarcoma. HER2 stands for the human epidermal growth factor, and it signals cells to grow or divide when it is activated by the protein ERBB2. This is HER2 functioning normally in a cell. This one's HER2, and as it gets the signal from ERBB2, it sends a signal to the nucleus to grow or divide. Osteosarcoma is an aggressive bone cancer that accounts for 35% of all primary bone cancers and 1 to 2% of cancers in humans. At time of diagnosis, 15 to 20% of patients have detectable metastases that have usually spread to their lungs, but sometimes to other bones as well. However, 80% of patients have micrometastases that cannot be detected at the time of diagnosis. These metastases signify a more aggressive and faster growing subset of tumors. Patients without pulmonary metastases at the time of diagnosis have a 70% survival rate, whereas those with pulmonary metastases at the time of diagnosis have a much lower survival rate of 30 to 50%. This is why the treatment for osteosarcoma includes chemotherapy before and after surgery to control the tumor itself and the detectable and undetectable metastases. The three options for surgery are limb salvage, rotation-plasty, or amputation, which are then followed by more chemotherapy to attempt to control or kill any remaining malignancies. Yet even with all this treatment, 30% of patients still relapse, and 65 to 80% of these relapses are pulmonary metastases. Osteosarcoma in dogs bears a striking resemblance both clinically and histopathologically to osteosarcoma in humans, and is therefore used as a model to treat the human cancer. As in humans, it most commonly affects the long bones, specifically the radius and ulna, but also the humerus, femur, and tibia. However, it can also be found in the skull, jaw, and pelvis. 90 to 95% of dogs are considered to have metastases at time of diagnosis, so their subset of tumors are much more aggressive generally than those of humans. My lab developed a drug to specifically target these tumors by targeting HER2 expression. The target of my mentor's treatment was the overexpression of HER2. HER2 expression in patients with osteosarcoma is associated with increased risk of metastases and defines a subset of patients with a more aggressive tumor phenotype. I was most involved in staining the slides of osteosarcoma using immunohistochemistry and rating the levels of HER2 expression to analyze them. Cells of a tissue the first antibody you use attaches to the protein, and the second antibody attaches to the first antibody, and then the two antibodies are stained, which is essentially staining the desired antigen, which in our case is HER2. I created a scale to rate the levels of HER2 expression, which I determined by eye using a microscope. For example, in this staining, it would be rated around 2+, because the staining is the brown spots, whereas in this one, it would be 4+ in certain areas as there's much more brown staining, but 1+ in areas in these sections because there's much more blue staining, which indicates no HER2 expression. Based on the level of HER2 expression and gathered information of lifespan, we determined that the greater the HER2 expression of the tumor, the shorter the event-free survival of the dog was. This is a small portion of the table I created and the scaling system I used. As you can see, the higher the scale, the shorter the event-free survival. We attached the antigen indicators of HER2 onto the exterior of Listeria virus, which we used as vectors. As the dog's T cells mark the virus for destruction and eliminate it, they become specialized to HER2. These specialized T cells are then reproduced by the body and attack the tumor in areas of HER2 expression. This treatment, there are no real worries of serious adverse effects because the Listeria vectors are stimulating the dog's own immune system, so it won't reject the T cells. This treatment is currently in phase 1 trials, which is just a measure of how safe the treatment is. It can only be administered after the standard standard treatment has been administered. 3 dogs have finished the treatment at the lowest dose, and 2 are currently in the middle dose treatment. Sasha was the first trial dog, and she's very cute, although I was not allowed to touch her. So far, the treatment has proven to be safe, and we can only speculate, but as none of the dogs have relapsed, it seems to be effective as well. Hopefully this treatment will continue through trials and become an accepted treatment. Thank you, and I'd like to thank Dr. Cox and my mentor, Dr. Cole Mason.